Sure. So we actually started training with Batang on maternal behaviors and maternal skills that we might have to call on about 3 years before Red was born. So this birth has actually been about 12 years in the making. There's a lot of things that go into it, and the maternal training was just one part of that. But we started kind of very early on, essentially before she got pregnant, because I think, as most females can attest to, once you are pregnant, sometimes you don't want to do as many things, you don't feel so great. So we intentionally started a couple years before she even came off of her contraceptive. And some of the things that we've trained her to do are come up to the mesh and present different body parts. A lot of the maternal stuff that we've done with her, we actually have just a plush orangutan that we got at the zoo gift shop, of all places, that we let her have, and she was trained to bring that over to the mesh, to the keepers, and present it for bottle feedings. We also just trained her on a simple cue that was just get the baby. So sometimes mothers, especially first-time mothers, won't necessarily kind of know exactly what to do right away, and leave babies on the ground or leave them unattended. And so one of the behaviors that we taught her was, go get your baby and bring your baby to us, and go pick your baby up. So anytime she left that little kind of plush orangutan laying on the ground and came over to us without it, we tell her, nope, gotta get your baby, gotta get your baby. She learned that pretty quickly. She needed to carry it around with her. We also trained her to kind of position it correctly. So teaching her to cradle it was something that we worked on. Initially, she was kind of carrying the plush orangutan around, by an arm or a leg, which of course the plush orangutan doesn't mind, but a baby certainly would. So we were rewarding her for holding it close to her in an appropriate position. So.
Okay. And how was the training seeming to have paid off?
Well, what we've been saying all along is all the training that we put in is essentially an insurance policy. So best case scenario for us is that she's learned all these things, she has all these skills that we might need to call on, but best case scenario is that we don't have to ask her to do any of those things. And that, thankfully, in the last week, we've found that that's essentially been the case. She's kind of taken to motherhood very well. We haven't had any instances where we have had to call in any of the maternal training or surrogate training that we've done with her. She's doing a great job on her own, which is everything that we could have hoped for.
You had some plan Bs and Cs in place.
We had several, yeah. So we covered all the bases as best we could for all possible scenarios and talked through them and did as much training as we could for those scenarios. So one scenario could have been that Batang was caring for her infant properly, but maybe just either wasn't lactating or wasn't producing enough milk or wasn't very thrilled with nursing. So that was where the bottle training came in. We also did some training with 2 of our other females, one who has had an offspring herself and one who hadn't. And they learned a lot of the same behaviors of, get the baby, bring the baby to the mesh, so that essentially if Batang wasn't interested at all in raising her baby, that we could then potentially give it to a surrogate to raise. So what we really want is to not have to hand rear that infant. Of course, the best mother would be Batang. Second best would be another orangutan female that's going to care properly. But we want that baby to, grow up with other orangutans, not necessarily with us. So that was our last case scenario.
That's great.
Yeah.
Super. Thank you so much.